Hi, this is Carol Ann again, and so we talked about you could use ozone in different parts of your body. And so what I'm going to talk about right now is doing an ear insufflation. Ears, you think, why are we putting it in your ears? Well, your tympanic membrane is a very thin, thin membrane just filled with capillaries. And guess what? They're so tiny and the membrane is so thin that this ozone can actually transmit oxygen into your bloodstream through the capillaries running through your tympanic membrane. That's pretty cool. So this is a way that we're going to be able to get ozone into your head and neck. It actually is going to go through the tympanic membrane and also actually go through it into your sinuses and into your station tube and fill the area into your face. And you might even start to smell ozone after we do this. And so it's going to go in there, and what it does is it gets into your bloodstream, gets into the mucous membranes of your sinuses, and it actually can pass through the blood-brain barrier and get into the brain. And many of us, not just people who are getting older, but we have a lot of times brain fog, and it's caused from different toxins and different things that we're exposed to, even metal toxicities. And so if we can get the ozone up into this neural cavity up in our brains, we might be able to help detox the brain a little bit and also boost the immune system up in the brain, which might be very helpful to diminish brain fog. And so that's exciting. So basically, again, we're going to turn on our ozone machine and see the blue light. This time we're going to grab a syringe, a 60cc ozone safe syringe. We are about to fill our syringe for our ear insufflation. So first thing we do is turn on the ozonator and attach our syringe, and just gently, as I say, that gentle screwing on. You don't have to screw it on too tight, just nicely and gently. Now, so we want to only use a 1/4 liter per minute to get a 25 gamma to put in our ears. So we're going to gently turn this regulator from 0 to 1/4. Okay, and you can see it's filling the syringe. And just like it happened to me just a little bit ago, I didn't turn this the right direction and the syringe popped off. You have to turn that down to 0 fairly quickly. As it gets to about maybe 50, start turning this down to 0, or else you will pop your plunger across the room. And so now we will turn off the ozonator. And now, this is pretty cool about ozone. If you are worried about losing ozone from this, just hold your tip up and unscrew your syringe. And oxygen is heavier than ozone, so it will prevent the ozone from coming out of the syringe. It's pretty cool. So you just hold your syringe up and the ozone will remain in the syringe, okay? Now we are going to put ozone in our ears. And what we're going to do is get a little piece of cotton, and you're going to dip it in your water. I'm pretending this. And then you're going to take that little bit of water and you're going to dab it and let it drip a little bit, and it might tickle and feel cold and make you giggle, but just drip a little bit of water into that ear canal. Then hold your ear like this, and you might want to then put your finger over the top of the syringe and gently put the tip right into the face of your ear canal, into that opening. Then you are going to gently push on the syringe and you'll feel the flow of ozone. And right now I'm feeling a lovely warm sensation in my ear, and I can feel this flow. And you want to try to go half of the syringe to about maybe 35. I had more ozone in, but you want to do about half of the syringe in one ear. And my ear feels lovely warm. And that's showing that the ozone is actually going through the membranes of my ear and going through. And it feels fine. All right, then I put this down and I get a little more water. And I'm going to just go and do the other side. And drip a little bit of water in there, get that in there. And then tip it up, put it here, and gently flow the ozone into the ear. And it's done. And there you go. That is an ear insufflation of ozone. Very simple. Thank you. All right, we have just completed both ear insufflations, and I just want you to know that you can do these ear insufflations daily, especially if you're someone who has chronic sinusitis or you have chronic issues that cause your thinking to be confused or muddled, or you feel your concentration is less. So you can do this daily. If you are having a cold or having an active sinus infection, you can do this more times a day. So, and you can do it as tolerated. So I wouldn't do it like every hour, but probably 3 to 4 times a day if you have an active infection would be helpful.